I would never recommend aversive or suppressive methods in my behavior therapy plans, especially when behavioral euthanasia is on the table. But first, let's lay some ground rules for the comments section. I am a certified dog behavior consultant. I am an expert in my field where I specialize in aggression and nervous system dysregulation. I own my own business and have for 6 years. I stay up to date on the latest research in the canine behavior realm and the different fields which inform that realm. My continuing education game is strong, and I regularly connect with and collaborate with other behavior consultants, veterinarians, veterinary behaviorists, other experts in this field. So I am more than happy to share my knowledge and answer good faith questions in the comments, but I will not be engaging in or entertaining bad faith comments. Okay, let's talk about it. So behavioral euthanasia is often a consideration in my cases. I have made several videos on what the options are in a behavior case, and I'll briefly touch on them here. So we have management only, management combined with behavior therapy, the R's, that's rescue, rehome, return to shelter, return to breeder, etc., or behavioral euthanasia. Those are the 4 options, always. Part of my job is to help clients understand their options so they can make informed decisions. My job is never to make that call for the people, but rather to help them consider all of the different considerations that come with making these decisions. And that includes things like risk assessment, to society, to other family members, and to the pet in question. It also includes things like quality of life for community, for the pet in question, for the rest of the household. It includes things like legal liability. So there are a lot of considerations, and only the pet parent can decide what is sustainable for them, what is accessible to them, and what is an appropriate level of risk for them. When I first started out, I'm a crossover trainer, and when I first started out, we didn't use tools, but it was very much like leadership training. And my mentor at the time really put down positive reinforcement people. And I didn't really know anything about positive reinforcement. This had been sort of my entrance into dog training. But I remember her saying once that positive reinforcement people would rather unalive a dog than tell them no. And I'm autistic, and I took that at face value. And I was like, oh my God, that's terrible. And these extreme statements, right, are obviously problematic. First of all, that's just not true. Second of all, it takes a very nuanced and careful conversation that is informed by evidence, by science, by psychology, by the neurosciences, by biology, by ethology, and it boils it down into this like really extreme soundbite. And I think that people who hold that sort of belief probably don't have a good understanding of the scenarios in which behavioral euthanasia is an option. Most often, people are choosing behavioral euthanasia because the other options either present too high of a risk, either to household members, society, or the pet themselves, or quality of life is too poor in the other options for the other household members or for the pet themselves. People pick behavioral euthanasia when the other options are not safe or sustainable. I'm going to give a couple examples of what that might look like. Let's say that we have a dog who is behaving aggressively, and they are maybe behaving aggressively towards other pets in the home, towards children in the home, towards other vulnerable populations in the home. Maybe they are a risk to other dogs or people in society outside of the home. Maybe they are a risk to their family members, their humans. I would never take a client through their risk assessment and their look at quality of life and sustainability of our current management plan and say, okay, well, nothing else has worked, so let's start suppressing the behavior. And my number one reason for that isn't even because that would be a terrible way to treat the animal, but because it is unequivocally dangerous. Aggressive behavior is functional. We do not, under any circumstance, cure aggressive behavior. It is a natural, normal, functional behavior. So when we're working with aggression, the goal is to decrease the animal's need to use the aggressive behavior. We give them other coping skills. We reduce their stress. We change their emotions. We satiate their needs. We set up management. If we are using aversive or suppressive methods, meaning we are intentionally doing things as part of our plan to make the biting less likely, to make the growling less likely, to make the snapping or the lunging or the barking less likely, all we're doing is punishing our warning signs. We are messing up our data, and we are increasing the possibility that someone is going to be seriously injured. Because those suppressive methods only suppress the behavior. They don't take away the original function of the behavior. So there is still an unmet need. That dog still has reason to bite. And we are going to lose our warning signs, which means that down the road, the chances that a higher level incident will occur and that there will be no or little warning signs leading up to it increases exponentially. So it would never be ethical for me to suggest in that case that we bring in aversive or suppressive methods as a last-ditch effort to avoid behavioral euthanasia. And that doesn't even touch on the fact that most of my client population is behaving in an aggressive way because they are experiencing nervous system dysregulation. They have anxiety disorders. They have trauma. They're being exposed to chronic stress. Their nervous system is in a chronic state of hyper or hypoarousal. We can look at that and see how that would also be really unethical. There are other reasons that people choose behavioral euthanasia, so it may not just be risk of aggression. It may also be related to quality of life. So if a dog, despite our best interventions, is still living with very toxic levels of stress on a regular basis, most of these dogs can be supported with a myriad of different options. But if it's enough, depends on a lot of factors. And unfortunately, some of those factors include things like financial accessibility to support, financial accessibility to vet care, financial accessibility to behavior medication, and pain management. It can also come down to living spaces. It can come down to a myriad of resources or lack thereof that the human has access to, including their support system around them. But it can also come down to what's happening in the individual dog. There might also be scenarios where we're not talking about aggressive behavior and risk in that way, but we're talking about quality of life of the dog or the human. Some dogs have behavioral concerns with contraindicated management plans. A dog who has both separation anxiety and displays aggressive behaviors in contexts where the human is around. And while in an ideal world, there are tons of other resources to pull on, again, that can often come down to social support. That can often come down to financial accessibility. It can come down to geography. So you might have a situation where the dog is, despite our best efforts with medical intervention, with vet care, with behavior therapy, is still experiencing such a low quality of life that it is not ethically sustainable. And again, that is a decision for the pet parent to make, or their veterinarian and veterinary behaviorist may make that recommendation. So we would never take an animal suffering from a phobia or an anxiety disorder and say, well, your quality of life is so poor that we're going to have to euthanize otherwise. Let's introduce fear or pain. Let's suppress the obvious signs of your discomfort to make it easier for the human. Potentially we're saying, so you don't destroy the house when you're left alone, or so you don't, jump out of a third-story window when you're left alone. But that dog is still feeling intense panic, and their quality of life is going to plummet now that they can't express that as well. So again, we have a situation where introducing suppressive or aversive methods, punishment, yelling at the dog, penny cans, spray bottles, shot collars, prong collars, they are not improving the dog's quality of life, which was the whole concern in the first place.